I'll go ahead and pass it on to our facilitators. Um, Noah and Lauren are our pre-health ambassadors here with us today, and Noah's going to get us started. If you want to go ahead, Noah.
Yeah, like Ethan said, my name is Noah. I'm a pre-health ambassador with Lauren. So if the three panelists, right? Or two panelists. Yeah, if you guys want to introduce yourself, say what field you're in and stuff like that, that'd be awesome. And then we can get started with some questions.
I'll jump in. My name is Rebecca Field, and I'm with the College of Pharmacy at the University of Arizona, the R. Ken Coit College of Pharmacy at the University of Arizona. And I coordinate undergraduate advising for our pharmaceutical sciences major, pre-pharmacy advising, and I also sit on the admissions panel for our Pharmd program.
Hi, my name is Amanda Lopez. I am one of the admission and onboarding advisors for the College of Nursing. I specifically work with students, either current students, prospective students who are interested in our entry-level program. So that includes our 2 Bachelor of Science pathways, our conventional Bachelor of Science program in Tucson, and our integrative health program in Gilbert, as well as our Masters of Science entry to the profession of nursing, which is located both in Tucson as well as right now at the biomedical campus in Phoenix, but we'll be moving to Gilbert very soon. So nursing is growing our presence in Gilbert, but very excited to be here. Thank you.
Awesome. Thank you so much for coming today. So we have some questions lined up that we can ask you guys. But again, Sarah, if you have any questions, this is like meant for you and stuff. So please feel free to jump in and ask any questions that you want. But I'll get started with kind of a basic one. For both pharmacy and nursing, what does the selection process look like at U of A?
You can go ahead and start, Amanda, since I know Sarah is specifically looking at nursing.
No, not a problem. So for actually our 2 entry pathways, they have very similar requirements and admissions processes and steps, but I'll really stick more to the bachelor's pathway for this. So when a student is coming to the University of Arizona, the good news about how we structure our admissions is that we do have the pre-nursing pathway, the pre-nursing major that is structured to align with our admissions requirements. Students would typically spend the first 4 semesters on working on their general education requirements and their prerequisites, and typically would apply to the College of Nursing professional program about the 2nd semester of sophomore year. However, that may vary depending on how many credits a student is taking in a semester, if they brought in or transferred in credits from a community college or from high school. So that kind of varies overall. And then from there, though, students don't have to be under the pre-nursing major as well. So maybe they are under another academic major. They could still work to meet our prerequisite requirements and general education requirements and still apply. So that's kind of 2 pathways that we tend to see, either someone specifically on pre-nursing or maybe someone coming from a different academic major. Again, the core really, as far as the first 4 semesters of education, is focused on the prereqs, and then you head into the actual admissions steps in which students have certain requirements that they meet. We have 2 GPA requirements that are needed to apply. One is a 3.0 prerequisite GPA, so of those prerequisite courses that are taken, and an overall 3.0 cumulative GPA of all coursework that's taken. We do also require the HESI A2. It's a standard nursing entrance exam. Many colleges or nursing programs utilize it, in which students will take that. And then we also utilize other criteria, what we call holistic criteria in the process. We do evaluate certain types of experiences, anywhere from leadership to previous healthcare experience to academic honors or more specifically association with the honors college or an honors program, military service or Peace Corps service, and even just general volunteer work in the community. And then we also incorporate an interview process for selected students. We've actually been doing it virtually now for almost the past 2 years since the pandemic, and that's allowed for a little bit more flexibility and comfort of home when interviewing. But those are the 5 main criteria and aspects for someone applying for the College of Nursing, either Bachelor's of Science in Nursing Conventional or Integrative Health.
And did you have a question, Sarah?
Yeah, so I'm a senior. So do you mind going over the MEPN
Oh yeah,
program as well?
no, not a problem. Yeah, so the MEPN, we call it MEPN. We also call it MS MEPN. We live in a world of acronyms, so it all varies. But it's a Master of Science entry to the profession of nursing. So this is actually a post bachelor's degree for individuals who already have a non-nursing bachelor's degree. So maybe, and we've seen the gambit of different bachelor's degrees. So psychology, public health, nutrition, to engineering, business, education. And so that is the key difference, is that it's a post-bachelor's degree. However, the actual admissions steps and requirements are almost identical. We have about the same amount of prerequisites that are required in order to apply. We don't have an expiration on those, so those could be taken during undergraduate or post-degree, and that sometimes happens with people, especially if they're coming from more like of an arts background, that they need some of those additional sciences and they can take those really almost anywhere. We partner really well with our community college partners like PIMA and the Maricopa Community College System to have equivalencies of prereq courses throughout the state, but they would still do all their prereqs, and then the same 5 criteria apply actually. So we have 2 GPA requirements, we have the HESI, which is required, and then same evaluation of experiences and the interview. The only difference with GPA is that instead of cumulative, we review the most recent 60 credits or the last 60 units. So some of that actually may be, it starts the most recent class that you've taken back to 60 units. So it won't encompass all of your bachelor's degree. And for most applicants, it will encompass some of those maybe newer prereqs that they've had to take in order to be eligible and move their way backwards. And that could also come through multiple schools. But we actually have 1 application cycle a year. And that application opens October through December, specifically October 15th through December 15th. And that's for admissions for the following May. So the program itself is 15 months and starts every May and finishes the following summer. So it's also a little accelerated. You go 4 semesters back to back to back, but it is very foundational in the sense that there's the structure is very similar to our BSN program because the emphasis is on entry to the profession. But the great thing too about the MS MEPN program is you utilize your foundation and your background in this other area of knowledge. And that helps you in so many ways, whether it's the way that you communicate, it's the way maybe, especially if you do come from another health sciences background, things like nutrition and public health, all can help with the way that you maybe work and evaluate patients and view things like nutrition in a healthcare plan, or even just anywhere, even English or people in education, they bring that background to nursing, which is really unique because there's so many transferable skills that are important in nursing that can be really valued. So I know that was more than what you asked, but just more of an explanation on that. But the good news is that it's actually very similar to our bachelor's pathway with the 5 requirements. The only slight differences is the GPA calculation, a few differences with the prereq courses, and then the time frame for application is different than our bachelor programs.
Thank you.
I guess I'll jump in really quickly just to just mention that pharmacy is an excellent broad profession to get into. I know a lot of people just focus on pharmacy being the pharmacist behind the counter at CVS and Walgreens, and certainly that's where a lot of pharmacists work, but it's a really broad profession. A lot of pharmacists do work very hands-on with patients, providing direct healthcare. And so it's a great pathway for students who are most interested in the treatment side of healthcare. So in order to become a pharmacist, you need a 4-year Pharmd degree, and entry into the Pharmd program just requires completion of a very specific set of prerequisites. Students actually don't even need a bachelor's degree to get into pharmacy school, which is a little unusual. So you just need general chemistry, organic chemistry, physiology, a handful of gen eds that students can complete in as few as 2 years. Many students take more time than that. So admission to the Pharmd program is based on success in those prerequisite courses, demonstration of academic capability, an interview process, recommendations, but really the academic background is going to be the heart of the admission process. I do also just want to mention, based on your interests, that we do offer several dual degree programs that go along hand in hand with the Pharmd. One of them is a Pharmd MEPN dual degree, where students in 5 years could have both the Pharmd and the MEPN with the FNP certificate. So this is obviously it's really specialized. We don't get a lot of students we've only had it for 2 years. And so far, I think we've had maybe 4 students who've been admitted to the program, but it's qualifying students for this really unique set of qualifications where they can both diagnose and prescribe and sort of be all-in-one healthcare providers. We're really seeing this as being as filling a unique need, especially in rural communities where access to healthcare providers might be more limited. Imagine what you could do as someone who has both a nursing degree and a Pharmd. So that's a little bit above and beyond, but if you are torn between multiple professions and you want to do it all, then the Pharmd and MEPN could be something of interest to you.
Thank you. I actually didn't know that. That's actually really cool.
If you were interested in doing something like that.
All right, guys, it looks like we can move on to our next question.
Okay.
I'm so sorry. Go ahead. Keep going.
Oh, no, I was just going to say that students who are interested in that actually apply to both programs at the same time. So, in the fall of your senior year, you would apply to both the Pharmd and the MEPN. And if you were admitted to both programs, the flow would be that you would complete the MEPN first. So you would get that all done within your first year and then just kind of roll right into the Pharmd. And the benefit is that you can double dip a few classes along the way. So it does shave off some time and some effort as opposed to if you did them separately.
And I do want to add, so technically it's a MEPN Pharmd DMP. So also from there, you get into your Doctor of Nursing practice. I believe it started off doing a certificate, but I believe it's actually moving towards doing the full doctoral program. So it would be both the doctor at the very end, it would be the full actually doing your Pharmd and your Doctor of Nursing practice. So that adds more upon more upon more. That does make it a little bit lengthy because on top of that, so that just trying to calculate, that's probably about additional 4 or 5 years to collectively between the master's, the Pharmd, and then the DMP. But as Rebecca mentioned, it's still fairly new. And I know in general for our doctoral programs is that right now we do have the full doctoral degrees, and then we have certificates. It looks like industry and the profession is moving a little bit away from certificates to full doctoral programs. So I feel like that's probably where some of that shift may be coming, is just the emphasis and whether I'm not exactly sure if it's a requirement or just that the profession is just moving more towards full doctoral programs instead of certificates.
Thanks for sharing that, Amanda. It is always it's early in the process, right? But
yes, it's still in in its infancy. But it's one of those aspects of, especially too, as Rebecca mentioned, just having more utility in a role. And I know that especially in healthcare, and having programs that allow for additional education is really to build more of a multi-use professional, especially in rural areas, which in Arizona we know that we have, but in areas really throughout the United States, in smaller areas, you really only have 1 or 2 doctors, you have a handful of nurse practitioners, you have maybe 1 or 2 pharmacists. And so being able to have a more utility in your role and have a wider scope can be very helpful in especially those scenarios, in those settings. We are still, because it's so early in the program, we haven't had anyone graduate yet, but we're hopeful to see that, what the impact of this program will be. And if anything, just like this program has gotten influence, I know the College of Pharmacy has partnerships with multiple colleges in the university. So if anything, it's trying to see, what happens from this partnership or how other partnerships impact education in general, but also looking at the health landscape, both from a career development side, but also just in practice and where that's going to lead more schools and more programs to partner.
I have like I don't know if this is like a stupid question, but like, what's the difference between like a doctor and like a nurse practitioner? Because like I've looked up the rules online and I feel like they're kind of similar. And I just like, I'm not really quite sure like which path like would be best for me. And so, because this all sounds like really great to me, especially like I did not know about this like new like program. I think that's like super cool that you could go like from like MEPN to like Pharmd and then like to your doctor of nursing practice. Like that's actually really cool.
Yeah. I can go to a little bit of this. I'm more familiar with our entry programs, not as much with the Doctor of Pharmacy, but what I do, or not the Doctor of Pharmacy, the Doctor of Nursing practice compared to an actual, doctoral program or MD program. I just believe it's within the scope of practice that an NP has, and compared to an actual physician, they have the allowability for, I believe, when it comes to prescribing medications or something within treatment plans. But to be honest, I'm not as familiar with that differentiation, just because that's something I don't typically work with. But if there's any other insights that anybody has, please feel free to chime in.
And yeah, I don't have as a pre-health advisor, I don't have a really clear sense of exactly what those distinctions are, right? Because you can be a provider as a nurse practitioner, a provider as a physician. And so, yeah, they're like in the nitty gritty details of what the scope of practice is. And so, usually in those circumstances, I recommend shadowing and doing informational interviews with nurse practitioners and physicians and trying to explore kind of, what are the pros and cons? What seems like, philosophically like a better fit for you? Scope of practice also matters, right? Life-work balance, right? Time to degree, right? All those things, can factor in. But I would be, I don't have a lot of details about what that difference is in the scope of practice either. Good question.
That's all good. No, thank you.
Okay. I think we're good to move on to our next question, which is, what advice would you give to a student considering your school, or I guess more specifically, since we're the same school, your program?
So as far as advice, I think that it goes a few fold. I think there's academics, and then there's experiences, and then I think career exploration. I think, to Ethan's point, I absolutely recommend applicants research in whatever capacity they can on just making sure that this is the right pathway for them. This takes time and energy, and lots of just blood, sweat, and tears, to be honest, just because of the amount of coursework and test prep and everything that you're doing to get ready. We want to make sure that you are ready to pursue this pathway. And we would hate for someone to get all the way through, whether starting a program or through a program and realize, I don't think that this is for me. So things like informational interviews, participation in exploration activities, events, shadowing, anything that you could do to just learn more about it, even just researching online. Looking at videos, looking at information on the careers in general, just so that way you can get a sense of, okay, this is what it's going to be like. There'll be aspects that you can't ever really predict until you're in it. But as far as in a full way, just getting an idea of what roles are available, what would someone in this role do, what are their responsibilities, what is their schedule like, those are all things that it will be important to know. And then from there on the like extracurricular side, we do for our applications evaluate experiences. If it aligns in healthcare where you really wanted to do volunteering and shadowing in healthcare, that's great. That would work in your application. However, also think about what's important to you and what's in your time allotment, trying to manage your time and put your priorities in order, whether that's academics or work or, even family. How can extracurriculars kind of meld into that? And what's a healthy outlet for you too? One thing that we always talk about from beginning to end is not only just the care plan of a patient, but the care plans for students, for professionals, and what are things that are healthy outlets for you that will help you, that will help with stress, manage your time. And so if you're really invested in a club sport or student council or resident life, really utilize whatever experience there, and make it your own, because as I mentioned, transferable skills, especially in the entry-level programs, is big. Any experience you have, from customer service to being in a team environment for a class project, all of those experiences in some way could be a transferable skill to a healthcare profession. So it's, as much as that it's great to have healthcare background, if it doesn't quite fit in your schedule and time, don't also force feed it, because then it's going to feel like a forced experience, and no one really looks back at those and be like, man, I felt like I had to do it, not that I wanted to do it. And so really pursuing things that you want to do. And then academically, of course, doing the best foot forward you can. Very similar to what Rebecca was saying with the College of Pharmacy, academics does play a role in our admissions process. And so really putting your best effort forward, but also knowing, that it's okay if you don't have a perfect semester, and really thinking about, okay, if something falters or something doesn't go, exactly right, what do I do next? Resiliency is big. And even doing that academically, when you have a setback or a challenge, or maybe you didn't get the grade you wanted, those are all things that, it's important for students to plan out and think about, but also putting your best foot forward, not just in your prerequisite courses, but all of your courses, because they all do have an impact on your GPA. So utilizing your resources on campus as well, whether it's the writing center, other tutoring services, even just your office hours, all of those things are amazingly good habits to build, that's going to be successful and help you build a good foundation when you get into really any healthcare pathway. But I know for the College of Nursing, it will too.
That was so much good advice. I don't know. Don't know how much I can add on top of that, but I'll just echo certainly the first information you shared as far as, do your research, shadow, explore. There are so many different areas that you can work in within healthcare. And I think a lot of people really focus on, medicine, nursing, pharmacy as being like these obvious choices. But then understanding what the day-to-day life really looks like between those different fields, take some exploration. And then there are other lesser known fields of medicine or in healthcare that people might not consider. So do your research, shadow, explore, get work experience where you can. From the Pharmd admission side of things, I can say that we are really looking for students who know what they're getting into. So that's a lot of our interview process, is asking students to articulate why pharmacy, why not nursing, why is this seem like the right fit as opposed to the many other directions you could have gone? Because, you know, students are making a huge investment in their time and a financial investment. We want to make sure that people are going to be happy with their choice and that they're using their time well. And then as far as the preparation side of things, Amanda, you also had some great advice about how to make the best use of your time as an undergraduate. You know, use this time to figure out your study habits, your time management. We see a lot of students struggle in the first year of pharmacy school because it is such a step up in rigor. And I think that's true for pretty much most health profession programs. And students who maybe didn't have a lot of rigorous coursework as an undergraduate or had really light schedules, struggle with that adjustment. You know, speaking for pharmacy, the first semester schedule is 19 units of 800 level coursework, and plus out of classroom experiences and volunteering and whatnot. So it's a lot. So anything you can do now to just make sure that your time management skills are exceptional and that you really know how to manage your time, integrating life work, you know, having life work balance, schoolwork balance, use this time to develop those skills. It'll help you a lot down the road.
Can I ask a quick follow-up, Rebecca? If a student wanted to explore the different dimensions of pharmacy because they only really knew like you can work at Walgreens, what do you recommend for them to get connected and find those kind of like other kind of clinical niche pharmacy roles that students know a little bit less about?
As far as actually just doing research or actually connecting with professionals? Or
Connecting with professionals, or yeah, whatever you
yeah,
think
I mean, from our perspective within the college, and we're fortunate that pretty much all of our pharmacy faculty are also working pharmacists and they have clinics. You know, we have our faculty work in Banner, they have clinics all over town. Obviously, things have been rough during COVID because faculty have not been able to have students come into the hospitals as they used to. But that's generally the best starting point, is if a student lets me know that they're really interested in a particular area of pharmacy, they want to work with gerontology, they want to work in emergency medicine, they want to work with diabetes. We have faculty who are working in all these different areas, and we have a network of preceptors all over the state of Arizona. And even if a student can't get into a clinic at this time because of restrictions, most of our faculty are very willing to have a meeting, you know, in person or over Zoom to talk about what they do. Even if they can't showcase it, they'll still have the conversation.
Cool, thank you.
Mm-hmm.
Sarah, do you have any specific questions before I go into the next one?
No, not right now. Thank you.
Okay, awesome. So let's see. What would you say is like the biggest thing, or a couple of big things that stand out when you look at applicants, whether that's like grades, whether that's like community service type stuff? What kind of stands out to you that makes an applicant competitive?
It's a good question, because everyone, I think, comes with a different set of skills and experiences. And I think with our two entry programs too, those look a little different from our bachelor's level, which is a little bit more of a traditional age college student compared to our master's entry program, which could be anywhere from someone who is starting, who's just graduating with their bachelor's degree, or people who are pivoting in their careers, and maybe they were in another field for a few years, 5 years, 10 years, even more, and now are shifting to nursing. So I'll kind of talk a little bit about both, just so that way there's, you know, a broader sense of what that looks like for those two entry points. I would say on the bachelor's level, I think you know, well-roundedness. And I know that's kind of a vague term, but I think, you know, that's where an applicant is both, of course, academically successful, but also, is involved or has other things outside of school. I think, too, going back to Rebecca's point about time management, that is absolutely an important aspect. And whether you like it or not, once you actually get into the nursing program, that too is fairly intensive with time and being able to manage your time. And sometimes the best way to do that is to have things outside of the classroom, whether that's a job, whether it's an extracurricular, whether, you are a research assistant, whatever that looks like, having things outside of class is going to be more reflective of what is a much more realistic schedule and day to day than it is if you're just solely focused on academics. I also think it's the ability for, especially in our interviews, it's for students to relay those transferable skills. We don't expect students to come into the program with a healthcare background. Some do. We have some students who come in, maybe they were a nursing assistant or a caregiver or a patient care technician, pharmacy technician. I mean, they've come from a lot more of these more entry level roles. And so that's great because they do have some experience when it comes to maybe directly dealing with patients or customers. But at the same time, we can also relay that if you worked in retail, or maybe you worked in the service industry, or maybe you were a tour guide. And so I feel like successful candidates are able to look at the skill set that they've developed in other areas and figure out, how does that relate to what I would possibly be doing in nursing? And then also to chime in with Rebecca saying about, doing your research and knowing, why specifically nursing, why the College of Nursing, because that too helps not only just us see, but will help remind you as an applicant or a student, remember, why am I doing this? What is this all for again? Because there may be moments where you're like, wow, this is a lot. Like, is this really worth it? And when you really go back to, but you know what, this is why I want to do it, this is my goal, these are what I want to have, these are what I want to achieve, that just having that in sight always will help, have that motivation when it is maybe tough, or maybe you're unsure about what to do next. But I think those are all ways outside of, again, the traditional just academics that I think really makes them a more well-rounded candidate.
What to add? No, I'm pretty much out. I think on pharmacy side of things, we probably do have a more intense view of academics in such a broad field. We're not necessarily looking for a specific type of person, because some pharmacists are going to be very hands-on with patients delivering direct patient care. Other pharmacists are going to be more behind the scenes. So we're not looking for a particular personality, I guess, because a lot of folks could find a fit in pharmacy. We're definitely looking for the academic strengths. And then I would say, as far as, more broad qualities, we're looking for individuals who want to help and can articulate that they want to be in a helping profession. We're also looking for people who, we have a lot of ethics questions in our interview process. We're looking for very ethical care providers. Obviously, that's very critical in pharmacy. So, if someone has academic strength and they can just demonstrate, based on their experience and on how they, present themselves in the interview, that they want to be in a helping profession, that they care about healthcare, that they and that they have an ethical kind of approach to life, then they'll probably be strong candidates. On the academic side of things, we really, we do, of course, look at academic trends. We focus pretty strongly on science courses, but we're trying to look holistically at the transcript, looking for progress, looking to see, did students take a rigorous course load? Does it appear that someone intentionally went and took all of their organic chemistry at community college instead of taking it at the university? Nothing held against students who are transferring community colleges, but if someone, we look for patterns in how students approach their academic coursework. So there's not just one right way to approach your application or the admission process. We're looking for all kinds of good candidates.
I have a quick question that came to mind. So I'm a senior and I'm going to be graduating this year. And I was wondering if you guys have any like recommendations for like job, because I'm going to be taking a gap year because I do have to retake classes. You guys have any like job recommendations for me to get like hands-on experience in any like of the medical setting? Yeah.
I mean, the easy answer on my side is always pharmacy technician. That's kind of a, you don't actually have to be a certified licensed pharmacy technician to get into a pharm tech position. You can just apply to work as a technician and get on the job training. So that's a common misperception. People think they have to go through a tech trainee program to even get a job. That's not true. So if you are looking for some sort of experience, even if you don't see yourself being a pharmacist long-term, but you want to become familiar with medications, you want that experience with the public, you want some sort of healthcare experience, a pharmacy technician position could be a good way to go. And there's a dire need for pharmacy techs right now. So the jobs are aplenty. There are signing bonuses. There's all kinds of they're good opportunities. So that's the one that comes to my mind.
And is there like a distinction between like a good pharm tech job and a less good one? Like what should students just look for, kind of anything that's out there and they're pretty equivalent, or are there some that are better than others?
I don't know the details as far as at that level, but I think if you were looking for a technician position in a clinic or a hospital, then, being licensed as a technician might make you more competitive. But if you're, looking for something behind the counter at CVS or Target or something like that, I think the work is probably pretty standardized in those locations. So yeah, whatever works for you.
Yeah, a lot of entry level healthcare roles is again what I was talking about earlier. A lot of what we see when applicants apply, if they do have healthcare experience, and that could come from again, nursing assistants, caregivers is a common one that we see, emergency medical services, patient care technician, and some will vary. So I know specifically for like a caregiver role, a lot of companies will do that on the job training. It is fairly intensive. That is direct patient care, and a lot of that is home care. So you get a lot more of that foundation one-on-one aspect of working with a client. And then say if you wanted to take the next step to do a certified nursing assistant, then that is typically some companies will do in-house training, but then sometimes they do want certified already, and you could go through a community college to do that. Primarily once you start to like the EMS level, emergency medical services, that's when you do have to have a certification or license to be even just an EMT basic. And so again, those are usually done at the community college level. And most of those are like 1 semester programs. There's also more too, if you just wanted to get in a hospital setting, more administrative roles in say office settings, more administrative support roles that you could kind of delve into. That is again more on the other side of healthcare, but at least gets you into a system where you can get a feel for what especially a hospital setting can look like. So I think too is kind of thinking about what skills do you have right now, what settings do you feel like you want to be in, and then if you want to have something else, would that require additional time? Is that something you want to invest in? Again, it's not required seemingly for it looks like any of our programs, but it's great to have that experience if you can. And then how much you want to also kind of invest time and money wise if you wanted to do those extra certifications. But I know for the hospital systems, they are so enticing because they provide really great benefits, whether it's just health insurance benefits, if you qualify for things like tuition support or tuition reimbursement. So some of the larger hospital systems offer a lot of great benefits. And so that could kind of help offset, okay, if I work here, what kind of benefits can they provide me as well? Because if anything too, it's almost an exploration for you, not so much what you can get from the experience, but also what can you get from, the benefits of there. And a lot of, hospital systems in general are in need of just a whole lot of roles. So too, you can think about maybe somewhere that you can grow, maybe a place that if you did start at an entry level and they did somewhat maybe support you through a program, what would that look like if you were to then be an RN with them, or a Pharmd with them? What kinds of opportunities and growths would be available? And maybe that could influence where you would like to maybe spend some time working.
Thank you.
Okay, Noah had to leave for class, so I'll be taking over the questions from here. It looks like we'll only have time for maybe like one more. We're going till 9. And I also wanted to add, I got my EMT certification and mine was only I only took the class for a month. So there are shorter term ones if you want like a quick turnaround. Anyways, on to our next question. I wanted to ask if there are any common myths that you hear about your program that maybe you could debunk or like comment on.
I think I've already addressed the big myth about pharmacy, and that's just that pharmacists just work at CVS and Walgreens. And that's, where we see them most of the time, but pharmacists are in any environment where healthcare is being delivered, pharmacists are part of that healthcare team. So it really is a broad profession.
Yeah, I think that's gosh, I'm trying to think. I think it depends, on what your exposure been, because I think that for a lot of applicants or individuals that we talk to, they really use some of their experiences to frame what kind of patients or setting they want to work in. A lot of people want to work with babies, and I don't blame them. They're adorable and sweet, and it brings life into the world. But there's so much more beyond that. There's literally nurses in every healthcare setting, where it's long-term care to rehabilitation, and I think an aspect too that specifically our integrative health program focuses on is some different alternatives when it comes to therapeutic communication and care plans. And I think too, this actually, I'm sure is coming delving into the world of pharmacy as well, where we've had very traditional concepts of medicine and care, and that's now ever evolving. And I think that's also coming out too in the way that healthcare professionals are being trained, really looking at patients from a holistic way, whether it comes to their, of course, their age, but also their cultural and social economic background, and really evaluating that as an aspect of, why do they perceive healthcare in a certain way? Why have they been treated or have had this care plan set when maybe there's another way of doing things? So I feel like we think of healthcare as maybe almost very rigid, and I think nursing can sometimes come into that, but there's such a vast amount of roles, but also the way that they're communicating and working with patients is ever growing as well. Telemedicine is now becoming extremely popular, not just in places that have a rural population, but just due to the pandemic. So I think the modality as well is somewhat of not so much of a misconception, but just an evolution now too, of how professionals and patients are communicating. And I think that too is requiring professionals to not only have a great bedside manner, but also to have strong technology skills. So I think that's another thing that maybe sometimes students may not think, I don't need to know how to write an email. I don't need to know how to operate this. But in reality, it's all, the bigger aspect of a well-rounded professional. But I think too, just all of the different patient realms that someone could go in, and roles and settings, and especially I think in community healthcare is really growing. The need for nurses in community healthcare settings and working with different populations that maybe don't have the same type of access to healthcare, or traditionally have had little to low access to healthcare, and looking at things from a different social economic status. And I think it just is ever evolving and growing. So I think it's almost almost to expect the unexpected, but to also, always keep it's always growing. And I think that's why it's so hard sometimes. It's somewhat of a little bit of a moving target, but I think it's also makes it that much more exciting because there really is opportunity in every pathway.
Perfect. So we're getting towards the end here. So we'll go ahead and wrap it up. And I'm just going to jump in because we're short on time. Sorry, Lauren. If Rebecca and Amanda, thank you so very much for being here. I don't know if you mind sharing your contact details in the chat. If Sarah maybe wants to reach out to you and ask some more questions, I'm sure that would be really useful. But we really appreciate you taking the time today to be part of our virtual Health Professions Expo. And our next session, Sarah, or if y'all want to come, Rebecca and Amanda, we're having our keynote at 9:30, and it'll be Dr. Dirksen. His main focus is generally rural health, and so I think that'll be part of his focus in his keynote session today. But so I'm going to close the breakout rooms, but thank you so much, everyone. It's been a real pleasure, and I feel like this was a great panel.